when I started, I was using the device primarily for difficult surgeries where we had to get up really high, because a regular tourniquet blocks you. But with the HemaClear, I can get it all the way up to the axilla or all the way up to the groin for doing leg surgery. So we started using it for those special applications, but the more you use it, the more you get used to it. Then it's so quick just to put it on and there you go, and it's always sterile. And so now it's become our everyday tourniquet of choice for all cases. So it really doesn't matter if we're doing ankle surgery or tibia surgery or femur surgery. We use the HemaClear for all the cases now. So it's very simple for our staff. There's no maintenance of the box that comes with the regular wide tourniquet, and everything is sterile one-time use. There's no question that it's been used only once. I remember in the old days when we were using wide tourniquets and they would kind of be used over and over on multiple patients, and you kind of wondered which patient had that tourniquet on their leg before your patient and whether or not they were an infected case. So there's no question with the HemaClear you're getting a sterile device every time. It is important to learn about the product firsthand, because while it is simple to use, I mean there's two handles, you put it on the leg, there is a little bit of decision-making process in selecting which size to use. And so you have to understand the product, how it works. It's not very hard. The biggest benefit for this device is in cases where you need to get up really high. And that's really obvious. So if you have to operate on a fractured forearm, or you want to do an osteotomy of the humerus, and normally you would put a tourniquet around the upper forearm, you can't really do much work below that tourniquet on the humerus. With the HemaClear, you can roll it all the way up to the axilla. So you get a lot more space available to operate. And so that's an immediate benefit. The same thing is true in the leg. If you want to operate high on the thigh, with a standard tourniquet, your tourniquet comes at least halfway down the thigh, and that's as high as you can get. But with the HemaClear, you can roll it all the way up to the groin, really literally up to the femoral artery, and you can operate on almost the entire thigh.